5 things your nail can tell you about your health. Did you know your nails can reveal clues to your overall health? A touch of white here, a rosy tinge there, or some rippling or bumps may be a sign of disease in the body. Problems in the liver, lungs, and heart can show up in your nails. Before we continue, please note that all the information presented in this video has been verified, fact-checked, and reviewed by qualified health professionals. For the general population, nail health is most often an indicator of poor nutritional intake or poor digestion. Fingernails help protect the delicate tops of fingers from injury and come in handy when you want to peel an orange or scratch an itch. Healthy nails are strong with pink nails, but problems such as white spots, ridges, thickening, and changes to nail color or texture are common. Most of the time, these are harmless changes due to lifestyle or to a nail injury. However, in some cases your nails can reveal a lot about your general state of health, so it's important to recognize the signs of healthy nails as well as abnormalities that could indicate a medical problem. Not sure what's normal and what's not? Here are some clues to help you determine what healthy nails look like and when there could be a problem. Number 1. Clubbing nail. Clubbing, also known as digital clubbing or Hippocratic fingers, refers to the abnormal changes in the shape and texture of the nails and fingertips. In clubbing, the nails curve downward and the fingertips become enlarged and bulbous. This condition can affect one or more fingers and is usually painless. Clubbing is often associated with various underlying health problems, particularly those related to the heart and lungs. Some potential causes and conditions linked to clubbing include lung conditions. Clubbing can be an indicator of lung diseases such as lung cancer, chronic obstructive pulmonary disease, pulmonary fibrosis, and bronchiectasis. Heart conditions. Certain heart diseases like congenital heart defects, endocarditis, and cyanotic congenital heart disease can lead to clubbing. Inflammatory bowel disease. Conditions like Crohn's disease and ulcerative colitis, which are inflammatory bowel diseases, can be associated with clubbing. Liver disease. Cirrhosis and other advanced liver diseases can sometimes cause clubbing. Thyroid conditions. Hyperthyroidism and Graves' disease have been linked to clubbing in some cases. Celiac disease. In rare instances, celiac disease, an autoimmune disorder triggered by gluten consumption, can lead to clubbing. The exact mechanism behind clubbing is not fully understood, but it's thought to involve changes in blood flow and oxygenation to the fingertips and nail beds. The tissue beneath the nails experiences increased growth, leading to the characteristic bulbous appearance. If you notice clubbing of your nails or experience any other unusual symptoms, it's important to consult a healthcare professional for a proper evaluation. Clubbing itself is not a diagnosis, but rather a sign that warrants further investigation into its underlying cause. Number 2. Koilonychia or spoon nails. Koilonychia, commonly known as spoon nails, is a condition where the nails become abnormally thin and concave in shape, resembling a spoon. This means that the nails curve inward, creating a depression that can hold a drop of liquid. Instead of the usual convex curvature, the nail plate appears scooped out like a spoon. Koilonychia is often associated with various health conditions, with the most common being iron deficiency anemia. One of the primary causes of koilonychia is a significant lack of iron in the body, which leads to anemia. Iron is essential for the production of hemoglobin, the protein in red blood cells that carries oxygen. When the body is deficient in iron, it affects the nail bed and can result in the characteristic spoon-shaped nails. Hemochromatosis. This is a disorder where the body absorbs too much iron from the diet, leading to an excess of iron in various organs, including the skin and nails. Raynaud's disease. In some cases, koilonychia can be seen in individuals with Raynaud's disease, a condition where blood vessels in the extremities narrow in response to cold temperatures or stress, causing reduced blood flow. Lupus. Systemic lupus erythematosus, an autoimmune disease, can occasionally cause koilonychia. Number 3. Yellow nails. Yellow nails, also known as yellow nail syndrome, refer to a condition where the nails take on a yellowish hue, often accompanied by other changes in the nails and underlying health problems. This discoloration can affect all or just a few nails. Yellow nails can be associated with several potential causes and health conditions. Fungal infections. One of the most common reasons for yellow nails is a fungal infection of the nails or onychomycosis. Fungal infections can cause the nails to become thick, discolored, and brittle. Nail polish. Frequent use of nail polish, especially darker shades, can stain the nails and lead to a yellowish appearance. This is typically temporary and reversible. Respiratory conditions. In some cases, yellow nails can be a sign of underlying lung diseases such as chronic bronchitis or lung infections. Lymphedema. Yellow nails can be associated with lymphedema, a condition where excess lymph fluid accumulates, often causing swelling in the arms or legs. Psoriasis. Nail psoriasis, a condition that affects the nails in people with psoriasis, can lead to nail changes, including yellowing. Thyroid disorders. Certain thyroid conditions, particularly hyperthyroidism, can cause changes in the nails, including discoloration. Jaundice. Yellowing of the nails can sometimes be a result of jaundice, which is a yellowing of the skin and eyes due to liver problems. Diabetes. Although less common, yellow nails can be linked to diabetes. It's important to consult a healthcare professional if you notice yellowing of your nails, especially if it's persistent or accompanied by other symptoms. Proper diagnosis is crucial to determine the underlying cause and initiate appropriate treatment if necessary. Number 4. Terry's nails. Terry's nails is a nail condition characterized by certain changes in the appearance of the nails, particularly the fingernails. In Terry's nails, most of the nail appears to be white, with only a narrow band of pink or reddish color at the tip. This condition can affect multiple nails or just a few. Terry's nails can be associated with various underlying health conditions, and it's often considered a sign of an underlying systemic issue. Some potential conditions linked to Terry's nails include liver disease. Terry's nails can be seen in individuals with liver disorders, such as cirrhosis or chronic hepatitis. Congestive heart failure. This condition, where the heart is unable to pump blood effectively, can sometimes lead to changes in nail appearance, including Terry's nails. Diabetes. Terry's nails have been observed in individuals with diabetes, particularly those with poorly controlled blood sugar level. Aging. While Terry's nails are more commonly associated with underlying health conditions, they can also occur in older individuals without any specific health problem. Kidney disease. Kidney failure or chronic kidney disease can sometimes cause changes in nail appearance, including Terry's nails. Malnutrition. In some cases, malnutrition, especially protein deficiency, can lead to nail changes like Terry's nails. Cancer. Certain types of cancer, particularly lung cancer, have been linked to Terry's nails. It's important to emphasize that Terry's nails themselves are not a diagnosis, but rather a visual sign that could indicate an underlying health issue. If you notice this type of nail appearance or experience other symptoms, it's recommended to consult a healthcare professional for a proper evaluation and diagnosis. They will be able to determine the cause and recommend appropriate steps for further evaluation and management. Number 5. Bowes lines. Bowes lines are a nail abnormality characterized by horizontal depressions or ridges that traverse the nail plate. These lines can appear on one or more nails and are usually a result of a temporary disruption in nail growth due to various underlying factors. The lines can vary in depth and severity, and they might be accompanied by changes in nail texture. Bowes lines are often associated with illness or injury. Severe illnesses, high fevers, major surgery, and traumatic events can cause a temporary interruption in nail growth. Remember, your nails can provide valuable insights into your overall health, so it's essential to pay attention to any changes you might notice. If you have concerns about your nail health or any other health-related issues, always consult a qualified healthcare professional for proper guidance. If you have any questions or would like us to cover more topics related to health and wellness, please leave your suggestions in the comments section below. Your feedback is important to us. If you enjoyed the video, don't forget to give it a thumbs up and subscribe to our channel for more insightful content. Stay informed, stay healthy, and we'll see you in our next video.